everybody, welcome to my channel. I'm Dr. Perkins, a board-certified OBGYN. Oh my gosh, I am so passionate about women's health and allowing us to thrive. And so that's why we're here. But today we're really talking about what are the bad side effects of Ozempic. This is just trending right now. And while we're talking about Ozempic, really, these are just weight loss injections in many different forms. And what we're going to talk about today will, for the most part, apply to all of them. Ozempic is very effective, works wonderfully, but it's really not a casual medicine. And so we want to be aware of the possible side effects so that if you're contemplating trying them, or if you have been taking them, we will be aware of what to look out for and what the possible risks are so that you can make an informed decision. And that's what I'm all about here. So let's talk about it. So Ozempic is very effective at controlling blood sugar and helping with weight management. But like any other medication, it comes with risks and possible adverse effects. And so the first and the most common one are gastrointestinal effects. And so in short, I'll say GI symptoms. So gastrointestinal effects. These are the symptoms that most patients will feel within the first couple of days, maybe even the first couple of weeks of using Ozempic or any of the GLP-1s. These include nausea, vomiting, diarrhea, sometimes even constipation, or a feeling of an overall GI discomfort. Some people may have a lot of bloating, and some people may even notice a lot of burping, or you might even notice that you don't have an appetite anymore. And so while that's not necessarily a bad thing, and I say that with some caution because we want you to eat and we know that your body needs nourishment. But one of the ways that Ozempic works is to help to curb your appetite, sometimes a little bit too much. These symptoms, these GI symptoms, oftentimes are short-lived. Sometimes you just have to kind of get over that hump. And then once your body becomes what I call therapeutic, when the medicine is essentially really balanced in your body, the symptoms kind of dissipate to some degree. Some people will persistently have these symptoms. And if that's the case, this is a conversation or something that you want to discuss with your doctors, because you may want to discuss, do I maintain at the current dose? Do I go back down in case you recently increased the dosage? You want to find that middle ground so that you're not having discomfort, but still having the effects or the good effects from taking these medicines. Now, let's talk about things that are not as common. The first one is pancreatitis. This is an infection of your pancreas. Your pancreas is one of your GI organs. It produces insulin. Insulin is important for managing glucose. So remember that these medicines are really good at glucose reduction. And so the pancreas can become infected. This is usually a rare finding, but it's one that is emergent, one that if you are having this infection, it is very important that you seek care immediately. Now, you might be wondering, well, how do I know whether or not I have it? What should I look out for? In general, if you have an infection of your pancreas, you'll have extreme, severe pain in your abdomen. This is pain that builds up usually from like a little bit of pain, and then it progressively gets worse over time. Sometimes you might find that it's on the right side of your abdomen, your upper abdomen, not the lower part. And it just worsens over time. It may also worsen when you eat. And a part of the reason for that is that your pancreas becomes more active after you eat a meal. And so if it is infected, you may find that after a meal, this pain just worsens over time. It also may be associated with a lot of vomiting. Vomiting once for the day, not necessarily a big deal, but if you're unable to keep anything down and you're constantly vomiting, please seek medical care. GLP-1s, like Ozempic, have also been associated with gallbladder issues. The gallbladder is another organ that is tied into your GI system. So we have our pancreas that makes the insulin. The gallbladder helps to produce hormones that will help to break down fats. And so it also becomes really active after a meal, especially if we have a super fatty meal. Ozempic can lead to having inflammation of the bladder as well as gallstones. If you are experiencing gallstones or pain after eating, you should absolutely call your primary care doctor or the one who is prescribing your GLP-1 so you can talk about this and seek care and imaging as well as lab work to help to rule out your gallbladder being an issue. Now, these things that I've mentioned so far, all the GI effects, the gallbladder, the pancreas, these often happens within the earlier months of using GLP-1s. There are some things or other side effects that can develop over time. And so I'd like to talk about those now. The first is kidney issues or kidney injuries. Your kidneys are not a part of the GI tract, but your kidneys are really important with helping to get rid of toxins out of our blood. That's how we make urine, through our kidneys. And so they can become injured from taking a GLP-1. The reason that this can happen is because if you are having a lot of vomiting, if you're having diarrhea, your body can become dehydrated. If your body becomes dehydrated while you're taking a GLP-1, this dehydration can lead to your kidneys not functioning well and having an acute injury that sometimes can even lead to a chronic injury. And that just means an acute injury is a short-lived injury, and chronic just means that it's like permanent kidney damage. Ozempic has a black box warning on it that specifically talks about thyroid C-cell tumors. A tumor is a growth that could be cancerous, and Ozempic is specifically linked with the possibility of developing this over time. Now, this has been shown in animal studies, and the medical community, is actively researching whether or not this applies to humans as it had been in animal studies. But it is enough for us to have this black box warning on there because it is a potential risk and one that would be quite serious. Another possible effect, something that is called diabetic retinopathy. This usually happens in those with diabetes. We have a person who is diabetic and your body gets used to being in a state of having a lot of excess sugars around. And then you start to take Ozempic or one of the GLP-1s, and you have a very rapid decrease in your sugar levels. What can happen within your eyes is that rapid decrease in the glucose actually can cause you to have problems with your retina that can be permanent. In general, we want to slowly change our internal state when it comes to our sugars. We don't want a rapid decline. This is a part of the reason why GLP-1s are usually started on a very low dose, and then we incrementally increase the dosage over time because we don't want rapid changes internally, because your eyes can suffer in addition to other organs as well. So a lot of things can happen. Even though we're talking about many of them in this video, know that the likelihood of these things happening is still very slim. If we have underlying medical problems, we can have a higher risk. If we are extremely aggressive with our treatment, we can be at higher risk. But these are low likelihoods, low possibilities that we're talking about, but ones that I still want you to be aware of. If you are concerned because you're taking these medicines already, you want to discuss these things with your doctor. If you're considering the likelihood of starting Ozempic or starting a GLP-1, talk to your doctors about the likelihood of these things happening. Literally, you can even send them my video and say, hey, what's the likelihood of these things happening? What I want is for you to be informed. What I want is for you to get to your goals and get there safely. What I also want is for you to be hormonally balanced. So while we're talking about all these things and the changes that are happening with our insulin and our glucose, I'd like to send you a free copy of my ebook so that you will have this at your disposal as well. In this ebook, we talk about hormonal imbalance and the strategies that can help you get to a place where you're happier and you're healthier. If you'd like a copy, I'd love to send it to you. Just click on the link below this video. Thank you so much for being here. If you have a question about using Ozempic or these GLP-1s, go ahead and leave it below and I will respond. If needed, we'll make another video similar to this one. I hope you enjoyed. Thank you for being here today.